important things is to evaluate one's ovarian reserve. We do that by looking at how many follicles they have on day 2, 3, or 4 of their ultrasound. At that time of their cycle, the more follicles they have, the greater the chance they're going to produce more eggs. We also look at a blood test called the AMH, anti-Mullerian hormone level, and these levels are supposed to help us gauge how many eggs one will produce. Now, generally, the younger the patient, the more fertile the eggs are as well. So we're looking at women by their age, which is a predictor of egg quality, as well as ovarian reserve. So if we see a patient that has a high reserve, we're going to be more aware of their risk for multiple pregnancy. We might even start them on a lower dose of stimulation to prevent that from happening. In the event that we do the best we can and the patient still makes a lot of follicles, and we're concerned about the risk of them having a multiple pregnancy, we could always offer them the option to convert to an IVF cycle where we can control how many embryos we're putting in and not worry about that. As women age, we have more leeway in their egg production, theoretically, although it's still risky. You can't predict that just because a patient is 39 with 6 follicles, that only 1 egg is meant to be. But on the other hand, a 26-year-old with 6 or 7 eggs has a much higher chance of multiple pregnancy than a 39-year-old.